We've all heard it before. In fact, we all probably said it before when we were not ready to buy something or wanted to get out of a sales situation. It's the, I'll think about it, or I have to discuss it with my wife or my husband or kids or the next door neighbor. Hi, I'm Randy Baldwin, Vice President of Marketing for Hearing at CareCredit. And welcome to the 4th video in the series, Sound Strategies for Hearing Health. In the first 3 videos, we provided practical ways CareCredit can help you attract new patients, engage patients while they are in your practice, and how to have great financial conversations. In this video, we're going to provide ideas for an effective tested, not treated nurture program. When patients walk out of your practice needing, but not committing to, hearing health care, everyone loses. Patients miss out on precious conversations and the simple sounds that make life so enjoyable, like laughter, birds, and music. And the practice loses the opportunity to help someone live a better life and, of course, loses revenue. So the question is, why do patients walk out of the door knowing that they need hearing care? The answer varies and can be complex. Maybe the patient is not emotionally ready for hearing instruments. Or the answer can be as simple and solvable as not having a way to pay for the hearing devices. When the patient leaves the practice uncommitted to care, that shouldn't be the end of the conversation. It should be the start of your tested, not treated nurture strategy. There are a few easy and effective ways to reach out to patients and continue the hearing health conversation. First, within 2 or 3 days, make a follow-up telephone call. This is most powerful when the call is made by the hearing health professional. This call should address any stated questions or concerns the patient had or probe for the barrier to treatment. Here's what that call might sound like.
Hello?
Hello, may I speak with Mrs. Smith, please? This is Dr. Jones from ABC Audiology.
This is Mary Smith.
Good morning, Mrs. Smith. I hope you don't mind, but I wanted to follow up with you on your hearing health. Do you have a moment to talk?
Sure.
Mrs. Smith, when you left the practice, you mentioned you wanted to talk over my recommendations with your husband. Have you had a chance to do that?
No, not yet.
I understand. Mrs. Smith, your hearing health is important to me. You shared with me how upset you were when your granddaughter asked you to stop yelling at her. I want you to have great conversations with her and all your family and friends. Now, would it be all right with you if I gave you a call in a few days to see if your husband has any questions?
Sure.
And Mrs. Smith, I want to let you know that I don't want cost to be a reason you choose to delay getting the hearing instruments you need. Many of our patients prefer to pay for their hearing devices monthly. Is that something you would like to do should you decide to get hearing care?
Maybe.
You know what? My financial genius, Susie, took the initiative to use CareCredit's online payment calculator to see what your estimated monthly payment might be with CareCredit. She says it could be as low as X dollars a month. That's with 12 months promotional financing. I'll send you this information and give you time to talk it over with Mr. Smith. Then I'll follow up with you in, say, 2 weeks. Does that sound good?
Okay, sure.
Post-appointment nurture strategies can also include email and direct mail. Remember, it's helpful to provide information and content rather than sell the patient on a hearing aid. Focus on the social benefits of hearing and address the most common barriers to care, such as cost and payment options. If possible, share other patients' testimonials, because it's something we all heard before. When a patient walks out being able to hear life again, gee, I wish I've done this sooner. CareCredit has even more ideas and free tools to help you convert tested, not treated patients and help them live full, connected lives. Go to carecredit.com/soundstrategies or call 800-859-9975. Thank you for joining us for this 4th and final video in this series, Sound Strategies for Hearing Health.